All right, I think we're ready to go here. So good evening, everyone. Happy Wednesday evening, and thank you for spending some of your night with us here for an event we are calling Health Insurance Headaches, How to Navigate This Year's Open Enrollment. I'm John Ingold. I am a healthcare reporter for the Colorado Sun. So a lot of what I do is spending time writing about health insurance and how people can get health insurance, how much it costs, why it costs so much, how to make sure that you are finding the best coverage for you. So tonight we have three really excellent panelists, people who are just absolute experts in this field, and I'm thrilled to have them here. But first, I should note a message from our sponsor. So this event tonight, it's being sponsored by Kaiser Permanente. Kaiser Permanente is the state's largest nonprofit health plan, serving more than 500,000 Coloradans. It has served Colorado for more than 50 years, providing both healthcare and insurance coverage. And I should also note here, this is important for our panelists. While Kaiser Permanente helped make this event possible tonight, you should not construe this as any sort of favoring or recommending on behalf of our panelists of one insurance carrier over another. They're really out here working for everybody, and it's important to them that those lines not get crossed. So what we hope to do tonight is talk with you about health coverage, about what open enrollment is, about how to shop for plans, about some of the very technical terminology that sometimes you can run into here. And hopefully by the end of the night, you'll have a better understanding of how this all works and how to make the best decision for yourself and for your family. So let's get in here to introducing the panelists. First of all, we have Michael Conway. Mike is the Colorado Insurance Commissioner. He was appointed to this position by Governor Jared Polis in late 2018, and he had served the role on an interim basis prior to that. He's also an attorney. He previously worked at the Colorado Attorney General's office, and as the Commissioner of the Division of Insurance, he regulates health insurance plans in the individual, small group, and large group markets, and he also regulates all sorts of different insurance products, including auto insurance, homeowners insurance, those kinds of things. Next, we have Kevin Patterson. Kevin is the CEO of Connect for Health Colorado. Prior to that, he served in the administration of Governor John Hickenlooper as both the Chief Administrative Officer and the Interim Chief of Staff. Connect for Health is the state health insurance exchange. So it is the only place where you can buy subsidized health insurance plans if you are eligible for them. Last open enrollment, nearly 200,000 people used Connect for Health to purchase an insurance plan. And then lastly, we have Adam Fox. Adam is the Deputy Director of the Colorado Consumer Health Initiative. Adam joined CCHI in 2011 and has been involved in pretty much every major health policy, legislative initiative, and policy discussion since then. CCHI is a nonprofit advocacy organization that works to make healthcare more accessible and more affordable and more equitable here in Colorado. So thank you to all of you for being here. Why don't we just jump right into questions? But first of all, for folks who are watching at home and wanting to submit a question, you can email us at questions@coloradosun.com. Or there should be a little chat box or something at the bottom of your screen if you're watching this on our website or on YouTube. So first off, Mike, I thought we'd go with you. We're in open enrollment. Let's just go really, really basic. What is open enrollment, and kind of give us the lay of the land of what people are looking for when they're shopping out there.
Sure. So maybe this question should go to Kevin, but I'll take the first cut at it, and then Kevin, you jump in. But open enrollment is the time of year where people can come in and shop for plans. So it's the time of year from November 1st through January into February, where people can come in and shop for health insurance plans. They can, very importantly, find out if what level of subsidies that they're eligible for. And that's why it's so important to go to Connect for Health Colorado in order to actually see what subsidies you're eligible for when you're shopping for plans in the individual market. But this is that time of year that people that don't get their health insurance coverage from their employer can go on to Connect for Health Colorado, shop for plans, shop for the Colorado option plan, shop for other plans that are available on the exchange as well, and see what level of subsidies that they are going to be eligible for next year. And those subsidies, just to kind of highlight a couple of components related to those subsidies, if you haven't shopped on Connect for Health Colorado in the last 2 years, really, it's vital that you go on now because of the increased subsidies that were part of originally the American Rescue Plan, ARPA, and then separately were extended through a bill that was passed just a few months ago in order to extend those subsidies, the Inflation Reduction Act. Those subsidies are increased on Connect for Health Colorado, and they're going to help people save money next year for the next 3 years at least. And so again, to stress it, the only place you can get those subsidies are on Connect for Health Colorado. So it's really, really important for folks to go on to Kevin's shop and see what kind of help they can get from the original ARPA subsidies and now the Inflation Reduction Act.
Yeah, and Kevin, maybe you can talk a little bit about Connect for Health. I think sometimes when I talk to people and I say, well, it's the insurance exchange, and they're like, well, what does that mean? What is that? What does that actually do? So maybe you can kind of explain what Connect for Health is and what your role is in this situation.
Yeah, thanks, John. Appreciate the opportunity to talk to everybody tonight. So we are the place where people that don't get their health insurance from either Medicaid, Medicare, or at work, through their employment, this is the place where they come to get their health insurance. We are selling individual plans, which means they're tied to the person. And so if you're working a job and you're moving from place to place because you're taking some hours here, taking some hours there, your coverage moves with you. And so what we're able to do is we sell health insurance on our platform. And what we are able to do is have a shopping platform that will allow you to search through all of the plans that we have. There's 166 of them this year for the 6 carriers or insurance companies that are on the exchange, and find a plan in your zip code. There's a tool that can help you locate your doctor, your prescriptions, your network. If you're looking for a particular hospital, if you've got a chronic condition, you can figure out where to find the people that are going to take care of you and your family. But the great part about it is not only we're able to help you shop, we help you find financial assistance through the advanced premium tax credit. And so we work with the IRS and make sure that people get their tax credit in advance. So you're able to lower your premium every month. And as Mike said, it allows people to shop currently from now until January 15th. And we're able to save people large dollar amounts. Yes, we do have a table that we work with to help people understand what that means. But for a family of 4, it's a little over $100,000 a year that family will have an income, and that allows them to get tax credits. So it takes their premium from, let's say, an average of about $500 to about $135 a month. And so we really think that these are very significant programs to make sure folks are able to not just have the coverage, but if they're in a low enough poverty level, or they only make a certain dollar amount that's a little bit lower, they're able to get what we call cost share reduction. It's kind of like helping you pay for it as you use your insurance. And so we just try to make sure that people understand how they're actually engaging with the healthcare system. They know how to use their coverage and are able to get the care that they need for their families.
Yeah. So Kevin, why don't we go back a little bit on subsidies? And I should note here that a lot of what we're going to talk about tonight concerns the individual market, which, as you said, is where people who, if you're shopping for health insurance on your own, that's where you buy insurance. I think we're going to get into some questions here if you're shopping in the small group, the large group, if you have a plan through your employer. I think we're going to get into some questions that will help you, even if we're not talking directly about that. I think it'll help you kind of understand, okay, well, here's how I can actually pick a plan. I'm facing all these choices, all these different metal tiers. Here's how I pick a plan. But right now we're talking about the individual market. And you mentioned subsidies. So let's just go real bare bones here. Why do people qualify for subsidies? At what level do they qualify for subsidies? And at what level do you phase out of eligibility?
So the way that it works now, especially with the Inflation Reduction Act, prior to that, you would make that 400% of poverty, which is about that $100,000 a month for a family of four. And there was basically a cliff effect. And so you would be able to pull those tax credits, and then it kind of stopped at that particular point. And so now with the Inflation Reduction Act, you're able to still get subsidies at that higher amount. It's tied to a percentage of your income, but it still is, you're able to get reductions. And especially it's important for folks that are in their 50s before they get to Medicare, because it also mitigates for some of the age rating. So like if you're a 30-year-old in Mesa County, you'll probably be able to get a plan for about $300 or so, let's say, on the exchange, like a full-fledged plan. If you've got a condition, that same 55-year-old could find something in that same place for about $20 or $30 more a month, instead of a much larger amount that they typically would pay because of the age rating and that. And so we're able to see people really shop for the kinds of care that they need. I thought I had a link for the table. I'll keep looking for it, and I'll try to put that in the chat. If not, we'll send that out to folks later.
Okay, great.
John, can I jump just with one quick thing? So Kevin's absolutely right. The change from the subsidy cliff, that 400% of FPL, to the way that it's calculated now, it was massive. So that 400% of the federal poverty level meant that as soon as you made more than 400% of the federal poverty level, regardless of how much your health insurance was going to cost you, you didn't get any subsidies at all. Because of the Inflation Reduction Act and originally ARPA, the change now is the way it's calculated now is it's based off a percentage of your actual income. So if your health insurance costs are going to be less or more than 8.5% of your income, your annual income or your monthly income, depending on how the calculation you're working with, that's the subsidy that you're going to be able to qualify for and get. It ratchets down from there, and you're eligible for more, but that 400% federal poverty level, that cliff that Kevin was talking about, is now gone. And that's incredibly important for especially some of our higher cost living parts of the state. The mountain communities, Mesa County for that matter, the same issue comes into play there too. So that change was fundamental, and it's incredible. That's again why it's so important for people. Again, if you haven't shopped on the exchange in the last couple of years, to go and see what level of subsidies you're eligible for.
There's a lot of folks out there who maybe had previously tried to shop on the exchange, thought they weren't eligible, and now they are, right?
Correct. Yep, exactly right.
So Mike, your office, the insurance carriers have to submit their proposed plans to you and to your team for review, and you end up signing off on the rates. So I thought maybe you could give us an overview of what are the trends we're seeing in terms of prices for next year.
Yeah, thanks, John. So the prices for next year, on average, what we're seeing before those subsidies are included, that the rates went up on average throughout the state about 10%. But that's really just it's such a small part of the story. I hesitate to even almost kind of bring it up, but I think it's important to put out there in the first place. But the reason why I'd say it's such a small part of the story is because over 80% of the people that shop for their coverage on the exchange are eligible for subsidies. For those folks, they're going to actually have the opportunity to save massive amounts of money throughout the state if they go on to the exchange and they shop and they go to the lowest cost plans and their metal level. And I know, John, we're going to get into what metal level means at some point, so I won't bore people quite yet with that. But they can shave, like up in Mesa County, up in Summit County, they can save north of 60% on average if they go and they shop. And I mean, the savings out there and the opportunity for savings are just massive. And that's what the savings at the federal level, right? We've also instituted a number of programs and tools in Colorado that are going to save people next year in total in the individual market over $325 million between our reinsurance program, our rate review process, John, that you touched upon, and then the Colorado option. People are going to have the opportunity to save over $325 million in Colorado next year because of the things that we've instituted and over the last 4 years, because of the things, to your point from earlier, John, that Adam and the good folks at CCHI have helped get passed and get implemented. And that's when I first took this job, John, 4 years ago, the idea that I would be sitting here tonight telling you that people have the opportunity to save over $300 million in Colorado was beyond preposterous. But it's because of the great work that the advocates have done, that Governor Polis has done, and the legislature, bipartisan legislature, have been able to do. That's why people are going to be able to save money next year.
Man, and I hesitate to even think about reinsurance, trying to explain the complexities there. But Adam, I wanted to bring you in here, and I thought maybe you could help us out with some of the terminology. Metal tier, people are going to see co-insurance, deductible, out-of-pocket maximum. Can you help us understand, like, what are these terms that folks are going to need to know when they're looking at an insurance plan?
Sure. I think especially for the open enrollment period, the middle tiers are really an important distinction. So you have bronze, silver, gold, and in some cases platinum plans. And really what that means is it's a rough estimate of how much the insurance company covers versus how much you pay out of pocket under those plans. So it's an approximation of sort of how much you may pay under a plan. So generally, if you are talking bronze level plans, you're really just talking high deductible plans that ultimately leave you at some significant financial risk because you are going to have to pay out of pocket a fair amount before your insurance plan really starts to cover a lot of your care. Most people are often choosing silver level plans, and it's important to note that silver level plans are really the only plans that people can get some of the additional discounts on out-of-pocket costs if they qualify based on their income. So many people sort of gravitate to those silver level plans because they may be able to save not only on premiums, but on those out-of-pocket costs. And then if you have higher health needs or want better protection, you can jump to a gold level plan and higher if it's available. But really, when it comes down to it, to your point, John, it's important to understand sort of how your plan works and what it covers and at what level. Because if you're paying for a plan, you want to know what to expect when you're accessing care. And unfortunately, what we see is sort of an increase, especially in the employer market now, of a lot of people in these high deductible plans, and they're afraid to go access care because they know that they are going to potentially owe thousands of dollars before their health insurance really covers anything. So it's important to look at the deductible, which is essentially what you pay out of pocket before your health insurance starts to chip in for most services, except for preventive care and things like that. You have to figure out what the copays are, which is sort of a standard fee for accessing usually primary care and sort of routine care services. There's co-insurance, which is really hard to understand and something that we wish we could do away with because it makes it really impossible to predict what your costs are going to be. It essentially says you're going to pay a percentage of what the charge is, but you don't necessarily know what that charge is, so you don't know what you're going to pay. So all of these sort of terms and things can be really difficult to navigate and understand, okay, what am I really going to be paying? And that's part of the reason that it was really important for us through the Colorado option to standardize some of the plans and provide more benefits without any cost sharing, so that people can access more care up front before they have to pay their deductible or additional fees.
Yeah, you mentioned the Colorado option. It's another point we will get to here in just a little bit, but I want to go back and talk about cost sharing reductions. We've mentioned those a couple times. Kevin, could you explain how do people know if they're eligible for those? How exactly do those work?
Yeah, on our site, we have, usually it says in there that it's a CSR plan or a cost share reduction. And it's basically, it helps you pay for things that are coming out of pocket when you go to the doctor. And so if you have one of these plans, you will be able to access funds like when you go in, maybe there's a copayment. You'll be able to have assistance to help put out of pocket costs for that and for various levels of, especially around generic medicines, things that are on the formulary if you need to take it. Some test results are also covered. So a lot of the preventative services are included in there. And so what the thought process is behind that is, just because you're able to maybe afford their premium, we want to make sure that there's support for people to actually engage in using the healthcare to actually keep their health outcomes in a positive direction, and not wait until they're at some dire straits before they go in and see the doctor. Because we know better health outcomes, better in terms of costs for everybody, especially that particular patient, which keeps everybody's rates down.
So Kevin, I wanted to ask a little bit about the Connect for Health Colorado platform. People go to your website, which is connectforhealthco.com. I have that right?
You got it.
Good. What do they see, and what can they do there?
So you will see a welcome page that tells you where you need to start. It asks some questions around it. If you know what you're looking for, how do you get started? So if you're a new customer, returning customer, if you're looking for financial help, there's drop downs that will help you there. If you're just trying to get just generic information, there's actually a Health Insurance 101 tab there. And there at the far end, there's the We Can Help, which is where we have brokers, assisters, folks that are out in the community all over the state that can actually just walk people through if they're just feeling like overwhelmed with the number of choices. I tell people all the time, we have 166 plans, which actually went down this year. We were over 200 last year. And usually if you're at a large employer, you might have a handful, 3 or 4 options. And so when someone kind of makes the shift from coming off employer-sponsored insurance and they move over to the individual market, it can feel it's a daunting task if you're not sure what you're looking for. And so we always encourage people that they can seek out a broker, seek an assister usually at a community-based organization. We have a number of what we call certified application centers, which are in doctor's offices, some in hospitals, other clinics around the state. So when they're engaged in their services, they can say, hey, do you have health insurance? And we actually have people out there that can help them get signed up. We also have different questions that you can ask and go through our chat service, but we also are able to take phone calls. So we're just trying to find ways, however people want to engage with us, to help them understand how to get started.
Do you have a list of the assister sites and locations on your website, right?
Yes, you can get to it from that tab on the 4th one over.
Okay, yeah. Do you have a list of brokers as well?
There is a broker search tool. So what we're able to do is you can put in like your zip code, and we put you on a list of your name. You say, hey, I want to talk to a broker. We send it out to the list of brokers that are in that area. And as they respond, they're able to call you and actually can get you in. And usually what they'll do is set up an appointment and have you come in and walk you through what you need to do.
And so the assisters and some of those other non-broker entities, they're all free, right? They don't charge you any money.
No charge to you.
Use their services. And brokers in some case don't charge you to use their services. They actually get paid by the carrier.
That is the most common practice, correct?
Okay.
John, can I go back to the CSR question just real quick, just to highlight 2 things. One, folks, I love Connect for Health Colorado. I love the fact that we have our own state-based exchange. So you're going to hear me continue to talk and tell you to go onto the exchange to shop. But it's the reason why is the only place that you can get that CSR relief, the cost share relief that we were talking about, is on the exchange. If you go off exchange, you won't be able to get it. You won't be able to get that assistance. The other component that's really important for folks to keep in mind, if it is something that you want to look for, you got to shop for silver plans. It is income eligible based. So it's not available to everybody, but if you qualify, the only way that you can get the assistance is 2. 1, if you shop on the exchange, and 2, if you buy a silver plan. So just keep those components in mind. And then the last piece on this, again, because of another bill that CCHI helped push through a couple of years ago, we actually have expanded subsidies, cost share subsidies in the state of Colorado. So again, those are only eligible if you can only get access to those expanded subsidies for cost share help if you go on to the exchange. So obviously the gist of my talk so far tonight is to tell people to go on to the exchange and find out how much money you can save.
Yeah, I think we're also talking about the importance of shopping around this year. And we have a question from a viewer tonight noting that their health insurance is, I'm assuming this is if they're staying on the same plan, will be going up almost 30% next year, even taking into account the subsidy. So that would be the baseline of what they pay. For folks who are in that situation, what do you guys recommend?
I'll take the first cut at it, and then these gents can jump in. John, you hit on it. It's to shop, and it's actually to do what Kevin just talked about as well. Go talk to an assister, go talk to a broker about the different options that are out there, but to shop, most importantly, right? We put out a press release a couple of weeks ago at this point when we announced the rates, and we really tried to highlight how important this year in particular, and we always highlight that it's important to shop, but in particular this year because of the different dynamics that are in play in this year in particular, the savings that are available to people if they shop, even if they stay in the same metal level that they're in now, on average across the board throughout the state, there are substantial opportunities to save money. You may have to change carriers, and you may have to change healthcare plans, but those savings are there, and they're out there, and that's why it's so incredibly important this year to shop.
Anybody else want to jump in on that?
Just real quickly, I think it's always important for people to shop, but Mike is exactly right. This year, more than any, there's just been so many different dynamics of what's happened in the individual market and challenges we've had throughout the end of COVID and moving through a number of different activities at the federal and state level, that it's just really, really key that folks go in and shop. I mean, we see that our membership is a little more heterogeneous. It's not like everybody's looking for the cheapest plan. Some are looking for something that is very specific to what they're finding. They might have a particular carrier that they're having a continuation of care, but you might be able to find something with that same carrier that will still be able to save you money. And so I encourage everyone to make the time to shop, because you may be surprised at how much you can save.
Can I one last point on that? Sorry, there's
Please.
an ambulance or something.
Are you okay there?
I hope so. I don't know. We'll find out. The point that Kevin just made about not everybody being heterogeneous is absolutely correct. To keep in mind, don't just shop on premium, I guess is the point that I'm really getting to. It's really, and Adam talked about this before as well, it's really important for folks to look at the deductibles and the other cost shares that very well could be in play for their healthcare plan. It's quite often the case that when I'm out talking with people, that I have a conversation with somebody and they just shopped on premium and they didn't look and they didn't think about the impact that a deductible could have and may have on their lives if they need to get healthcare, if they have a big healthcare event. So really keep in mind that there's a lot of different components of your healthcare plan that you need to be thinking about. Premium is absolutely a key one, but so are the deductibles, and so are the other cost shares. And that's why the assisters that Kevin talked about can be incredibly helpful to help people think through those things. Brokers can be as well. And the different tools that Kevin talked about as well that Connect for Health has up on the website can be really, really great to help people figure those components out.
And I wanted to ask you guys about, we have two really, really, really new things this year, sort of first in the nation kind of things that we're seeing here in Colorado. One we've already mentioned, which is the Colorado option. Mike or Adam, do you guys want to explain what that is?
Adam, you go.
Sure. So the Colorado option is essentially a public-private partnership model where essentially the state has set a new standardized structure for these Colorado option plans, and then insurance companies are offering those plans through Connect for Health Colorado. So I saw somebody put in the question sort of how the Colorado option relates to Connect for Health Colorado. Essentially, those are new plans that insurance carriers who are already offering plans through Connect for Health Colorado, they're going to have to offer those Colorado option plans and make those available to folks throughout the state. And what's different about these Colorado option plans is there are a few things. One is they're standardized and there are more services that are covered with no cost upfront. So particularly routine primary care, behavioral health care, pre and post pregnancy care. Those services are covered with no additional copay, no cost share. And then there are also, these plans are required to achieve premium reductions, which is a little bit about what the commissioner mentioned earlier, is we're starting to require insurance carriers to lower their premiums. And for this year, for 2023, it's by 5%. That'll grow to 15% by 2025. And those reductions will make these plans more affordable for many people throughout the state. And so these are new plans that people really need to be looking into and seeing whether they can meet their needs. And again, want to emphasize sort of Kevin's point, there is this network of assistance sites and brokers that can help people enroll and navigate these options. But these are brand new to the market, and it's really important for people to shop around. And this is in particular why this year, because it really does shift some of the dynamics in the market.
Mike, from your perspective, what made the Colorado option so unique from what we see elsewhere in the country?
I think there's probably a few things, John, that make it unique. So Adam touched on the really important kind of high points of the Colorado option, but there's so much more that's built in underneath it, right? So the Colorado option requires, for example, the essential community providers to be part of the network. That's an insurance wonky term that doesn't mean much to anybody other than people like me or Adam or Kevin, people that you probably don't want to spend very much time talking to. But what it actually means in reality is that things like your federally qualified health centers that throughout the state are now part of those Colorado option networks that the healthcare companies are offering throughout the state. So people are going to have access to all sorts of different and new providers because of the requirements of the Colorado option. I think the other thing, that one of the most important things that makes it unique is the connection to what's called a 1332 waiver. So a 1332 waiver, it's again one of those wonky things, but for what's important for people to know is that through that 1332 waiver and through those premium reductions that Adam was talking about, we're able to go to the federal government. Whenever we reduce premiums in the individual market, we're also reducing the amount that the federal government pays in tax credits to people. So we can go to the federal government through that 1332 waiver and say, hey, federal government, you shouldn't keep that money. You should give it to Colorado so that we can reinvest it into the community to expand those subsidies, those expanded subsidies that I was talking about earlier. That's through a 1332 waiver. Because of the Colorado option, we're going to be able to expand subsidies even further, and then we're going to be able to expand coverage too, in ways that nobody else throughout the country has been able to accomplish. So it's those components, John, that I think are unique, and it's those kind of getting into the core points of the Colorado option where you really start to see it, and that the premium reduction requirements too, right? That's certainly an absolutely unique characteristic of our Colorado option versus what has occurred in other states.
I would be remiss here if I didn't note that in my own reporting and talking with insurance carriers, they are skeptical that they can reach some of those premium reduction targets while still providing actuarially sound rates. I think, Adam and Mike, you probably disagree with that, but just want to make sure we get that in on the record just for fairness sake.
Sure. John, let me you gotta let me respond to that after you throw it out there. So I have faith that we're going to be able to, that the market is going to respond like the market has said that it would respond and hit those premium reduction requirements. But there's also accountability measures in the Colorado option that are built in for that very specific purpose, John, that give the Division of Insurance the ability to require really the costs of the health insurance premium to be reduced in order to actually hit those premium reduction targets. But that's why it's so important for the marketplace itself. When I talk about the marketplace, what I mean is the the health insurance carriers, the hospitals, the doctors, to be partners in this work, and to work with us to make sure that we do hit those premium reduction targets, because that is what people care about right now, especially in a world where costs just across the board, not healthcare costs individually, but all of our costs. Things are becoming more expensive everywhere, and we have the opportunity to work together and save people money, and that's huge. And we should all be excited about that opportunity, and we should work together. But if the industry doesn't want to work together, then we have those accountability measures that we have in order to make sure that we hit those premium reduction targets.
Kevin, I wanted to ask you about another new product, maybe you would call it, that's available this year, and that's OmniSalute. Can you tell us about that?
Yeah, I really appreciate the opportunity to talk about that. And we're really excited about what we're able to see through the OmniSalute program. So that's a new program that provides undocumented Coloradans with a safe way to compare affordable health insurance plans and enroll in our new secure online platform called Colorado Connect. We have seen early interest and numbers in that enrollment that have far exceeded my expectations this far. So they're enrolling through that program for what we call Silver Enhanced Savings, which is the financial help that allows them to lower the cost of certain plans to a $0 premium. We have worked with a number of statewide immigrant serving community-based organizations. We have a network of brokers that have, and the sisters that have raised their hands to be the qualified and certified experts to work with these families. And we have an ability to get those folks connected to those experts that understand that journey and are very sensitive to the concerns those families have. And right now, I'm just getting texts from my staff that are just really impactful for how it's changing people's lives. It's really one of the best things I've worked on.
Yeah, and the backstory here, of course, is that folks who are in the country without documentation, they are not eligible for subsidies through the federal government, and so the state created this program to extend potential subsidized plans to folks, and that could hopefully chip away at sort of our biggest block of people who remain uninsured.
Yeah, I think there's a number of those folks that are uninsured, and we know that a lot of those folks will only come to the healthcare services when it's an emergent need, which is the worst way to get your healthcare because you're only dealing with the emergency, you're not preventing anything, and it's also the most expensive. And so that makes it expensive for everybody. So our hope is that we actually can get better outcomes for these families, but also keep rates for the rest of the public more mitigated by getting to these folks earlier.
So Adam, let's switch and start talking about some practical advice here for people who are going on Connect for Health or are trying to shop off exchange. They look at that like big long list of plans. They see all these metal tiers, all these different deductible values, all these different premium values. How do you recommend people look at plans and evaluate them to determine what they need? How do people know what they need for healthcare?
I think this is one of the reasons that it's so beneficial that we have a state-based marketplace, Connect for Health Colorado, because we've been able to build a variety of tools that help people sort of sort and filter plans based on a whole variety of criteria. So I think it's really important for people to use those. In addition to the assisters and brokers that are available that know the ins and outs of these plans and can help folks navigate them. But I think at the end of the day, what you're really talking about when you're comparing health insurance options is comparing your current medical needs versus what you might anticipate in the coming year and your comfort with risk financially. Because if you are comfortable with a fair amount of risk, you're reasonably healthy, then you may be comfortable enrolling in a bronze plan. But those are really limited in sort of the coverage until you hit really your deductible and out-of-pocket maximum. And so you may be paying thousands of dollars out of pocket before that plan really provides any benefit beyond those preventive care services. So it's important to really think about what you're comfortable with risk-wise, And in many cases, I think from our perspective, we really try to encourage consumers to think about, okay, yes, it might be a little bit more in premium to purchase a silver level plan, or a gold level plan, but those really provide such better protection for people's finances. If they do have something happen that's significant, it's really easy to rack up thousands of dollars in medical costs very quickly. And so it's important to sort of evaluate your own comfort with those risks and what you think your needs are going to be in the coming year.
I want to make sure we're getting here to reader questions. So we had one about going on Connect for Health and trying to enter your income information. And the income you're entering is supposed to be the income you expect to earn next year. So if you're self-employed, if your income varies quite a bit, how do you decide what to enter? How do you even guess what to do that? And knowing, of course, that if you underestimate your income and get a bigger subsidy than you're eligible for, you could actually be on the hook for paying some of that back. So Kevin, what are your thoughts there?
Yeah, so two things. One, there is the ability for folks, because we have a number of self-insured clients that are on our website, and you can take a portion of your advanced premium tax credit. So you can say, hey, I'm eligible to get $450 a month, but you can actually dial it back and say, well, I think I'll just take a portion of that. And we have some that are in the luxurious place where they actually just buy on the exchange and they just get their money back when they file. But what we try to tell people to do is work with a broker in those situations. They typically have clients that have the same types of fluctuations. You don't know what your fourth quarter is going to be, and you're trying to make a decision for what's going to happen next year. And so you probably don't know until a couple of weeks into next year what you really made. So that's a pretty common scenario for brokers to help really walk you through that. And so we ensure that people do that. If you have a tax preparation professional that's working with you, they can also help you figure out those kinds of questions. If it's a salary or you're on a fixed income from an early retirement or something like that, or you just have assets and you pull out money that you can control how much you're pulling out, you can manage it that way. But when it's fluctuating and you're like waiting to see how you do on the 31st, it does become a challenge. But that's when we really lean on those professionals to help you kind of navigate how to handle that, because they've seen it.
Yeah. We have a question here about silver level plans and whether they have health savings accounts. Are those just a bronze plan feature, or is that something that's available at the silver level as well? Uh-oh, I'm seeing eyebrows raised.
No, there are silver level plans that have that ability for that savings. I was just waiting to see who was going to say it first.
Yeah. Kevin, if people are having customer service issues on your website, what should they do?
So we do have an escalation team. There is an email address, executive-director@c4hco.com. We're able to take those kinds of issues and try to make sure that we respond to folks as quickly as possible. It usually takes a day or two for us to kind of, if we can, find what the problem is. I was working on one today that was like one strange thing that was happening for this one person that we just hadn't seen anywhere else. So, we will contact you back, make sure we've resolved that issue. So we do that all the time.
So Mike, we do have this year some changes in who is offering plans on the individual market. Bright Health and Oscar Health are no longer with us here in Colorado. What does that mean for folks who had previously been their customers?
Yeah, thanks, John. It's an important piece to highlight. So as you noted, Oscar Health Insurance company left the state, and Bright won't be offering plans anywhere in the country next year. Oscar just had a hard time competing. We have a very competitive market, and Oscar had a very hard time breaking into the market and gaining market share. So they made the decision to leave here and a handful of other states for similar reasons. And like I said, Bright, for their own financial reasons, won't be won't be offering plans anywhere in the country. What that means practically for people that were enrolled in either one, either that had coverage through Bright or Oscar, is that they have a special enrollment period at the end of this year. So at the end of this year, they can shop right now. So they can go in and they can shop on Connect for Health Colorado for coverage starting next year. But because they're losing their coverage because of the requirements of the Affordable Care Act and our own state law, they have what we call as a special enrollment period. So whereas the normal open enrollment will end on January 15th, those folks that lost the coverage from Oscar or Bright will have 60 days starting on January 1st to continue to shop for coverage. So it goes through effectively the end of February that they'll be able to continue to shop for coverage. But it's really important from my vantage point for people not to wait. And it's important because of the point that Adam made. You never know when something's going to happen. And if you don't have coverage in that period of time, if you wait until the end of February and something happens in January or in the month of February, if you get in a bad car accident, if you blow out your knee skiing, you'll be on the hook for those for those healthcare costs. So it's really important for people to go in and get covered.
So I'm hearing you correctly. People who have Bright and Oscar, if you don't do something this open enrollment or during your special open enrollment window, you're going to lose your coverage.
That is correct.
Yeah. Okay. Adam, we had a question on Medicaid and whether Medicaid coverage is portable across the state. I think the answer here is pretty clear, but you want to take that one?
Sure. If somebody qualifies for Medicaid in Colorado, they essentially have Medicaid throughout the state. Obviously, there are parts of our state that have more Medicaid providers at sort of their access. And we know that there are some rural areas in the state that really struggle with having enough Medicaid providers. But the coverage is in effect throughout the state if somebody qualifies.
And one thing we should note about Medicaid is that we are right now in a federal public health emergency still from COVID. At some point that emergency will end, and when that does, Medicaid could begin, I would say kicking people off. That's not quite the nicest way to put it, but they may end up disenrolling folks who currently have Medicaid coverage who are still on Medicaid's rolls, but who have seen their income level rise up enough that they're no longer eligible for Medicaid just based on income. So we should just note that if you do have Medicaid right now, make sure you're watching your mailbox, make sure that the state Medicaid department has all your information up to date so they can get a hold of you and redetermine your eligibility. Mike, we have a lot of questions on Medicare as well, and obviously unfortunately we're not talking about that as much tonight, but there are some resources that folks can use to help navigate finding Medicare coverage, and I thought you could maybe talk about that a little bit.
Sure. So just to belts and suspender it, so we make sure that everybody knows what we're talking about. So Medicare is for coverage when you get to be 65 or older. You're eligible for Medicare. We're actually in the middle of open enrollment for Medicare as well. It's a shorter time period for Medicare open enrollment. It only goes through December 7th. So you need to be shopping now if you are eligible. We have a SHIP program. So the SHIP program is the State Health Insurance Assistance Program, which is affectionately referred to as the SHIP program. So we dropped the A from the acronym. I don't know why we dropped the A from the acronym. Maybe it's just easier. And so the SHIP programs are really throughout the country. And in Colorado, the SHIP program is housed within the Division of Insurance. And that SHIP program, it's actually really similar to those assisters that Kevin was talking about that he has through Connect for Health Colorado. They're free resources for people to go out and ask questions about Medicare, ask questions about really the kind of cost shares that can be inherent in Medicare coverages and all sorts of different issues that people struggle with when they're shopping for a Medicare plan, just like they struggle when they're shopping for any kind of health insurance plan. So those resources are out there. Brokers can also, there are brokers that help folks get enrolled in Medicare plans as well. So there are resources out there. You can go onto our website, doi.colorado.gov, and we've got a page dedicated to the SHIP program, which is general information and the phone number and the different assistance sites throughout the state that people will be able to get that help that I talked about.
So up until now, we've talked about how to shop for coverage, how to find coverage. Adam, your organization also works with people once they are covered and helps them get the most out of it. So what are your top tips for helping people get the most out of their coverage, and what should folks do if they have a problem with their coverage?
So I think it's really important to understand sort of your insurance plan and sort of the general cost sharing and coverage that it provides, because it makes it a lot easier for you to predict what you're going to experience when you're accessing care. It's still tough sometimes to understand what you're going to be charged. And so we know that there are many Coloradans that walk out of a doctor's office or the hospital with a much larger bill than they anticipated. And that's really where things like our consumer assistance program that can help people navigate some of those billing issues comes into play. But first and foremost, the most important thing for people to do is always request an itemized bill, because there are so many billing errors in healthcare. You may be able to potentially find duplicate charges or charges that have been upcoded inappropriately or things like that that you can try to push back on to lower the bill that you're being charged for. And similarly, I think your insurance company should also be part of your sort of toolkit as a potential solution, because they may not have processed the claims correctly. So the bill you may receive may be higher than it should be. So you may be able to contact your insurance company and have them take a look at things and make sure that, at least from your coverage perspective, you're getting the benefit that you should. And if you still don't think that you are, that's when you contact the Division of Insurance and Mike's team, who really can help folks navigate some of those issues and appeals and things. But people can also reach out to us if they run into billing conundrums. The last thing that I'll say on this front is there are some new laws that really provide some additional protections, particularly for hospital care. There's a new law that requires some hospital discounted care requirements that all hospitals throughout the state have to meet. And this can apply to people who are uninsured or insured, at least up to 250% of the federal poverty level. They can provide benefits beyond that, but that's sort of the floor. And if hospitals aren't screening people, we need to hear about it, because that's required if people are uninsured. And if you're insured, you need to ask to be screened for hospital discounts.
Great. Well, so we are coming up on time here. So if anybody has any last minute questions, please put them in the chat or send them our way. But in the meantime, guys, any last minute thoughts you all have? Anything you want to share? We'll start with you, Mike.
I suppose my last minute thought is that this same kind of theme that I've had throughout this, that it's incredibly important for people to go on to Connect for Health Colorado right now during this open enrollment period to see what level of subsidies, whether they are eligible for subsidies, and what level of subsidies they are eligible for if they are. Like I said before, over 80% of the people currently enrolled in Connect for Health Colorado are eligible for subsidies, and the only place that you're going to be able to find those savings is if you go through Connect for Health Colorado. Past that, John, just thank you to the Colorado Sun. Thank you to CCHI for leading the charge on a lot of those bills that we've talked about that are really game-changing, life-changing bills for people. And thank you to Kevin and his crew over at C4 for all of the great work that they do every day.
Yeah, Kevin, any last minute thoughts from you? And I see we do have a question again on where folks can find that table that helps spell out subsidy eligibility.
Yeah, I thought we had it easily findable on our website. It just changed, and I think that's part of the new 23 numbers just came out. You can find it on healthcare.gov when you look for the APTC calculator table, folks can find it pretty quickly that way. Happy to send it to you if you want to send it out to the folks later on. So with the changes that we've seen with Bright and Oscar, basically 1 out of 5 of our customers have to look for a new plan. And so if you're trying to figure out what to do and you're just looking, we have an anonymous tool we call the Quick Cost Plan Finder tool. You won't have to look for it that way. It's a much easier way for you to find it. Just on our website, you'll see Explore Plans and Compare Costs and Plans. When you get to that, it'll ask you just some really simple questions on how much you think you're going to use your insurance. Do you have things on the formularies or a particular doctor that you're looking for? And it can actually show you the plans that are based on the ways that you've answered that question. And it's anonymous, so you can just look at it, make sure you know what you find there, because you'll have to use that to go in and shop if you decide to buy something through the exchange. We're trying to fix that between now and next year because we wanted to make sure that it was anonymous. People were very sensitive about their health information before they made a decision. So we split that off. But there are ways that we can just guide people through what can be a bit of overwhelming, whether it's on the website, through our call center, or with our brokers, assisters, and certified application centers across. Not only do they understand our programs, they understand their communities. And I think that's really, really important.
Yeah, we did get one question here under the wire about what happens if you're doing something like a Roth conversion that will give you what would appear to be a high level of income from the IRS's perspective, but not necessarily a high level of income from a salary or earnings perspective. That kind of sounds like maybe a broker question. It seems
I would start there, but I'm betting you might need a tax preparation professional as well. I am not authorized to give that kind of advice, and especially with the insurance commissioner on the line.
Hell of a job, Kevin. Hell of a job.
Adam, what are your last thoughts here?
I think just to reiterate, we have a state-based marketplace with a lot of tools and resources. There's a network of in-person assisters and brokers that can really help folks navigate these options. And it is so important for folks to review what they may be eligible for, not just the subsidies, but there are so many new plans with the Colorado option coming into play that may really benefit a lot of folks and provide better care upfront for a lot of the things that people need. So it's really important to review those options. And similar to Mike, I would like to thank both of these gentlemen, because passing these laws is one thing, implementing them is entirely another. And it requires folks like Connect for Health Colorado and our Division of Insurance to really make sure that these laws get implemented the way that they're supposed to, and that Coloradans get the benefit that they're supposed to.
Yeah. Well, guys, I just want to thank all three of you for being here tonight, for helping out, for answering questions from readers and viewers, and just being available to provide information. So, Mike, one thing we should make clear again: what's the open enrollment window that we're in right now?
The open enrollment window goes through January 15th for the vast majority of people that are shopping.
And if you want coverage by January 1st,
December 15th. You got to have your plan by December 15th. You miss that December 15th deadline, folks. If you buy a plan between December 15th and the end of January, your enrollment date will be in effectively the middle of January.
Okay, great. Well, so one more time, just want to note that this event has been sponsored by Kaiser Permanente, which is the state's largest nonprofit health plan, serving more than 500,000 Coloradans. If you want to learn more about Kaiser Permanente, you can go to kp.org/co. Again, want to thank our panelists. And, if you like what we do at the Colorado Sun, you can become a member. You can go to coloradosun.com/join. So I think that is it from us tonight. I hope everybody has a good evening, and thank you for your time.